Pretty much everyone has questions about sex. As a woman with a bleeding disorder, you most likely have some really important ones. Can I have sex if I have a bleeding disorder? Yes, you can still be sexually intimate. However, it's important to be aware that a bleed can happen anywhere your blood flows, and sex can involve parts of the body that have a lot of blood vessels. Sex, like most other strenuous physical activities for a person with a bleeding disorder, can potentially cause a bleed in any part of the body or in any joint, regardless of what position you're in. The purpose of sex is that you enjoy it, so it's important you work with your partner to find out what works best for you. Having pillows and blankets nearby if you need support can help too. During sex, how will I know I'm having a bleed? What should I do? The signs and symptoms won't be any different than those of usual bleeds. The most likely types women face are bruises, muscle bleeds in the calf or forearm, or a joint bleed. But signs and symptoms may not be visible right away. Vaginal bleeding during and after sex is not uncommon, even for women without bleeding disorders. If you have continual vaginal bleeding that goes on past a couple of days, or you need more than 2 pads a day, call your hemophilia treatment center or hematologist as soon as possible. If you experience an injury during sexual activity, stop and follow your usual treatment plan to avoid the risk of long-term damage. Don't be afraid to bring these situations up. HTC professionals have seen and heard it all before. There's nothing to be embarrassed about. I'm using birth control to manage my bleeding. Is there anything I need to know? When using contraceptives that help manage heavy menstrual bleeding, follow your prescribed treatment plan. With each method, make sure you understand and stick to the directions, including taking it every day at the same time, or the risk of pregnancy and heavier periods will increase. Chat with your medical provider. They'll help you choose the best birth control option for you. And talk with your medical provider if you're thinking about getting pregnant. Remember, only barrier methods like condoms help prevent sexually transmitted infections. How can I connect with my partner sexually when I'm experiencing bleeding or pain? Bleeding does not have to stop you from being sexually intimate. But sometimes after days of menstrual bleeding, having sex with your partner is the last thing you feel like doing. You can consider other sexual activity for you and your partner's pleasure, or you can engage in intimate activities with your partner, maybe sensual massage or cuddling. Connecting doesn't have to involve sex. If you're in pain, tell your partner. For most, sex and intimacy is a big part of your overall well-being. Communication with your partner will help you maintain a safe and healthy sexual experience. And remember, it is okay to ask any questions or bring any concerns to your healthcare provider. Find out more on our website, including topics like masturbation and contraceptives.